I'm just going to read the skills testing recording integrity statement. As a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that compromises the integrity of the skills testing recording. I'm going to go ahead and get started. Hi, I'm Shaya. I'm going to be your nurse for today. Can I get your name and date of birth, please? All right, perfect. Is it okay if I perform a quick assessment on your lungs? Yes? Okay. So they sound really congested. And I noticed the patient has a cough and it's non-productive, so they would really benefit from some NT suctioning. So I'm just gonna do some vital signs. And then I'm connecting that pulse ox. We don't have one, so I'm just gonna verbalize. So the pulse ox will be on technically during this whole video. In real life, it would be on for the whole NT suctioning therapy as well. Okay, so as I'm doing the vital signs, I'm gonna assess for any contraindications for this therapy. So that would be trauma to the face, trauma to the nose, low platelet count. So I am just gonna look at the labs, and it looked like they are within normal range. So that is great, it's good to go. Do you know what NT suctioning is? Yes, you kind of do. Yeah, so we're gonna go in with a tube, we'll go up your nose and kind of suck all that gunk out so you can breathe a little bit better. Also, the respiratory rate is in the 30s, so they have a really increased rate and they're definitely working really hard just to breathe. Okay, so this can be kind of a painful procedure because when we go through the nose, it can be kind of like irritating. So would you like any pain medication before we get started? No? Okay, so I'm gonna go grab my stuff. All right, I'm back with all the supplies. So pulse ox is still on. I'm gonna go ahead and get started. So washing my hands, putting gloves on. I'll put gloves on. Okay. All right. So I'm just gonna put this chuck on the patient so that all the phlegm will get on here. And then I'm gonna put on some PPE, so I guess I'd put on some glasses, maybe a mask, just for my protection. Okay, I'm gonna hook up the suction now. So I'm gonna turn on the suction. Just connecting it. Okay, so I want my suction to have a pressure from 80 to 150 millimeters of mercury. So I'm just testing it. I'm putting my thumb on it. So it looks like it's 120, so that's within range. Putting it right here. I'm gonna connect some oxygen because I want to hyper-oxygenate my patient before this therapy. So since they're on a nasal cannula, I'm gonna increase it to 6 liters because that's the maximum just to hyperoxygenate. Okay, so that's good to go. So I'm just gonna deglove. And then let me just actually, before I start with the sterile field, I'm just gonna put the patient up a little bit. Just a comfortable working height so I don't break my back. Up a little bit more. Okay, and then I'm just gonna put this side field down. Okay. Take gloves. Hand hygiene. All right. Okay, so I'm just gonna kind of get everything ready. So, put our sterile water. Did the hand hygiene. Okay. it as easy as possible for me. Okay, so here we are. Opening. Gonna toss it. Okay, I'm opening this. Okay. So I'm just gonna go ahead and take this from the sides.
And then carefully insert 3 to 4 inches.
I'm gonna open it.
And then intermittently suction for no longer than 15
I'm gonna pour the water, the distilled water.
in a rotating motion as we move out.
I'm gonna go ahead and open it now.
Okay? You put the oxygen back on.
Just gonna put some lube on.
And we assess whether the patient is tolerating everything. We're looking for any signs of adverse reactions.
And then now I'm gonna go ahead and put the sterile gloves on. Okay. So sterile gloves are on. I'm gonna take this, plop it down on the sterile field. This is the Y tubing, so discarded. Okay, so now I'm gonna make this hand not sterile. So I'm grabbing the suction. I'm gonna connect it. And then I wanna test it to see if it's working. So I'm gonna suck some distilled water from the box. Looks like that's a go. So now I'm gonna lube it up. I'm gonna lube it 2 to 3 inches. And then, can you take some deep breaths for me? Some deep breaths. Okay, perfect. And then I'm gonna take the oxygen off. I'm gonna put it on their head. Okay. And then I'm gonna have them take a deep breath and then I'm gonna go in. So deep breath.
Out of all of the days.
So 3 to 4 inches is to the pharynx. 8 to 9 inches is the trachea. So I'm gonna go to 8 to 9 inches just so I can remove a lot of gunk. So it's 8 to 9 inches. Now I'm gonna intermittently suck as I pull out. I'm gonna be kind of twisting it to try and get some of that congestion. I'm only doing this for 15 seconds max. Intermittently doing that. Okay, perfect. All right, and then I'm gonna put the oxygen back on. Whew. So, kind of fell off because their ears aren't great, but let's just say that oxygen is on. And so some contraindications that I'm gonna be looking for, or not contraindications, some adverse effects from this therapy is desatting. So they probably will have a low oxygen, they'll probably have that increased respiration rate, increased work of breathing, just because I kind of occluded their airway for a second. Some really big adverse effects that I want to look for are arrhythmias as well as like a bronchospasm. So I'm going to be monitoring for that. And then I'm going to wait technically 30 to 60 seconds before I go into the other nostril. In this case, for the sake of time, I'm not going to do that, but you can do this up to 3 times, waiting in between, of course, for those 30 to 60 seconds. And so I'm just going to go ahead and start to clean up. I'm going to turn off my oxygen. I'm going to take this, roll it up, trash. And then I'm just gonna go ahead and clean up my area. I'm gonna reassess their lung sounds. So just to kind of see how they're doing. So it sounds like the congestion improved. The oxygen saturation I'm gonna put down a little bit. But it looks like the oxygen is as good or it looks like it's improved for their pool socks. And so yeah, all in all, it seems like they benefited from it, so that's great. I'm just gonna put their bed down, and then yeah, just kind of cleaning up, making sure everything's in place, everything's thrown away. Okay, get that side rail back up. I'm just gonna take this out of the way, toss it. So making sure that the call light is within reach, their table, so this is all clean, technically, not really. Call light is within reach, bed is in the lowest position, side rail up. The table is within reach. There is nothing hazardous for falling that is in the room. And then I'm gonna go ahead and document, see how they tolerated that, or document how they tolerated. And just kind of give a brief summary, and that's my video.